Hello and welcome to this episode of Crate Conversation. I'm very excited to be here today with Kayla Klinzing. She is from the American Cancer Society, and I had a chance to meet up with you and talk about some of the things you have upcoming, and I thought it would be a great idea to have you on for a conversation so that our community can hear all of the great things that the American Cancer Society is doing, not only for Brick Township, but here in Ocean County and Monmouth County as well. So thank you for coming today.
Thank you so much for having me.
Thank
I'm really
you.
excited to be here and I appreciate the opportunity.
That's great. So how did you get involved with the American Cancer Society?
So I actually knew, from middle school that I wanted to work for a nonprofit. My mom actually works in assisted living, so I would volunteer with seniors, and my favorite part was when she would host fundraisers for different organizations, and that's kind of where my passion grew. And unfortunately, my family has been impacted by cancer, so the mission is very near and dear to my heart, something I'm very passionate about, and I want to be able to help as many people as I can, so hopefully other families don't have to go through what we did.
Oh, that's a really great background.
Thank you.
And knowing that you wanted to do it from such a young age,
Yeah.
it's like that's fantastic.
Yeah, so it kind of was a dream come true, and it couldn't have been better. You know, I live in Ocean County, and then our office is right in Manasquan, so
Oh,
it was
perfect.
kind of meant to be, yeah.
It was. That's fantastic. So tell us a little bit about what you do for the American Cancer Society and what I guess the American Cancer Society does for our community.
Yeah, of course. So I am a development manager. My primary role is I manage our Making Strides Against Breast Cancer walk that's in Point Pleasant Beach. A lot of people are super surprised to know it's the 4th largest breast cancer walk in the country.
Wow.
So people come from all over, not just Monmouth and Ocean counties, because they want to walk on the boardwalk. It's kind of a destination event. So now we are up to having about 22,000 people annually that come out to this event. It's in October every year, and it's honestly a year-round initiative. People think October, Breast Cancer Awareness Month, but actually it's year-round. So people can register as early as February, and they can continue to participate all through December.
Right. I imagine having planned events myself that the day after the event, you're like, this is great. We did a great job. And then the next day, you're like, all right, we start planning for next year,
back to
right?
it. Yeah, the fun never stops.
Yeah, it's
The
a
fun never
continuous
stops.
cycle. Exactly.
Yeah.
That's awesome. So aside from that, what else do you guys offer?
So I am proud to say that the American Cancer Society is the only organization that is able to improve lives of cancer patients and their loved ones through our research, state and federal advocacy efforts, and local programs and services. We want to ensure that all people impacted by cancer have the same opportunity to not only prevent, but also detect, treat, and survive cancer. So we have so many different resources, and honestly, the biggest one, and the one I want the most that everyone to really know about, is our 800 number.
Okay.
It's a 24/7 helpline. Absolutely anybody can call and be connected to a trained professional any day of the year, any time of the day. They could call as often as they want, whether it's just to speak to somebody, to be connected to local resources, and the number is 1-800-227-2345.
That's a great resource. I did
Yeah.
not know that existed, so
Yeah.
that's wonderful.
Yeah.
Excellent. And that's, like you said, 24 hours a day, 365, I guess, right?
Yes, it is. Yeah, so people can call, and even if you wanted to know about the events that are going on in your area, then it gets funneled down to the appropriate staff member. Or again, if you find out, unfortunately, your loved one was diagnosed with cancer and you just don't know how to properly support them, you can call that number as well. So it's really a great resource. I encourage everyone to put it in their phone because unfortunately so many people are impacted by cancer.
Right.
And I cannot tell you how many people will say, I wish I knew about this sooner.
Oh, that's great. And again, if you put it in your phone, even if you don't need it right now at this moment,
Yep.
you're not fumbling trying to figure out what the number is, at a later date. So that's great.
Absolutely, yeah.
I love that. That's a great tip. What else do you guys have going on?
So a few different resources that are really important and completely free to the general public. We have our Road to Recovery program. So if a cancer patient isn't able to get themselves to a cancer-related medical appointment, we actually have volunteers that will pick them up from their home, bring them to their medical appointment, and then get them home safely afterwards. And that's all completely free. So if somebody can't get themselves to their appointment, we want to make sure they're still getting the treatment that they need.
Yeah.
So that's definitely a big one. We also have our Hope Lodge, which is free lodging to cancer patients and their caregivers. If for some reason the treatment is too far from where they live and they need to be closer, they could stay in our Hope Lodge for the duration of their treatment. And we have over 30 Hope Lodges around the country.
Oh, wow.
The closest to this area are New York City and Philadelphia. So that's definitely something that people should know about as well, because again, we want to make sure people are getting that treatment.
And so that Hope Lodge, does that include if you have your family member is in the hospital and has to stay in for treatment for a few days? Does that offer the family member a place to stay?
Absolutely, yeah. So
Okay.
typically, what will end up happening is the patient themselves have the opportunity to stay at the Hope Lodge, and then typically one caregiver.
Okay.
So if that patient needs to stay in the hospital for whatever reason, that caregiver still has a place to stay.
Oh, that's good. Yeah, both of those things are huge stressors for families.
Absolutely.
Being able to get to treatment, because oftentimes the person who's driving you is still has a full-time job, or you have children at
Exactly.
home, or whatever the case is. So that makes it hard to get your loved one to their treatment for all the treatments that they need. And then also the lodge. I've had friends who have have had their family members been admitted for 3 or 4 days, and
Right.
to be in New York, and the traveling back and forth was just really very difficult.
Yeah,
So
it's strenuous and it's
Yeah.
an unnecessary stressor, especially when you have so much going on already. That shouldn't be something you have to worry
and
about.
it's like one more expense, right? That you're looking at.
exactly.
If I've got to get a hotel in the city, like how
Yeah.
much is that going to
It's
cost,
completely
right?
free.
Yeah. Oh, that's wonderful.
Yeah.
Yeah, that's so good to know. Very
Yeah,
good.
absolutely.
What else do you guys have going on?
So we actually have a new resource that I wanted to share. It's called our ACS Cares app. So it's an opportunity for people to download the ACS Cares app, and then they are able to get curated information based on their cancer journey. So whether you're diagnosed or your loved one is looking for more information to help better support you, you download the app and you're connected to our staff who can then provide those resources based on your specific cancer journey. And also you can be connected to trained volunteers that are able to provide non-clinical support. So basically just somebody to talk to that's been through a similar situation, because oftentimes you don't really know what to expect. There aren't a lot of people in your circle that can relate. So having that app, again, something completely free, is a great resource to know that's out there.
Yeah, that peer-to-peer conversation about,
Exactly, yep.
I've been through but what you've been through, you'll get through it too, and
Exactly.
giving them some helpful tips, or, just a listening ear sometimes is super
Exactly.
helpful. Yeah. Oh, that's really great.
Definitely. Yeah. So, and the biggest thing that I want to explain as well is that all of those free resources are available because of the donations that we do receive. I'm proud to say that 81% of every donated dollar goes directly back towards our mission.
Oh, that's
because
great.
we want to ensure people are receiving those resources that they need at absolutely no charge to them. So I know when people donate to certain organizations, they're hesitant because they're not sure where the money goes, but over 80% of every dollar does go back to our mission.
That's great.
Yeah.
That's great. Do you have anything coming up that you want the community to know about?
Yeah, absolutely. So, of course, we do have our Making Strides Against Breast Cancer walk. Those happen
Which you
in
can
October.
sign up for now.
Yes, you can sign up for now. This year it's going to be October 18th in Point Pleasant. We also have our Relay for Life initiative, and those take place all over the country. We have several in Monmouth and Ocean County. Those are actually happening right now and into the early summer months. And then we have our golf and gala events. There are so many ways to get involved, so I definitely encourage, if anybody wants to know what's going on, you can call that 800 number, or you could go to cancer.org. You simply put in your zip code and you can see all the great information and events that are happening in your
That's
area.
great. So maybe you don't want to do a walk, but you like to play golf, or maybe you
Exactly.
have like you like to go out to dinner or whatever.
Yeah.
That would be great. Yeah.
And another great thing too is if you have a company that wants to get involved, there's so many ways to get corporate engagement. I know a lot of people are looking to provide resources and opportunities to their employees. This is a great way to do that. We also offer sponsorship opportunities to be able to grow a partnership with companies as
Right.
well. So there's so many different ways to get involved.
That's amazing. There's more here than I even recognized was
Absolutely.
available to the community, and that's
Yeah.
great. And the fact that all of it's free,
Yep.
I think is amazing. And I think that anyone who listens to this all the way through and hears all the things that you have to offer, I feel like your phone might be ringing now, right? Not yours personally, but
Hey,
this is
you never
going
know.
to, put that out there to a lot of people. who may not have these resources or realize that these resources are available.
Absolutely. And honestly, the biggest thing that I can encourage is to volunteer. We're always looking for volunteers, whether it's coming to the day of event for our fundraising initiatives, or maybe you're looking to join one of our committees, or even be a Road to Recovery volunteer. Maybe you're looking to just connect with people and you're willing to help patients get to and from treatment. We're always looking for volunteers. And again, all of that information is on our website.
That's great. I know there are a lot of people out there that are looking for ways to help.
Yep.
And that's a great opportunity. It had never occurred to me to volunteer for anything with the American Cancer Society.
Yeah, maybe we'll see you at an upcoming
You never
event.
know. That would be awesome. Fantastic.
Yeah.
Is there anything else you'd like to share with anybody?
Honestly, the last thing I will say, and probably the most important, is to continue to get screened. So many people, especially later in life, think that they don't have to get screened anymore. And I'm hearing more often than not, people are getting diagnosed later in life.
Right.
And it's because they're no longer getting screened. Whether their doctor tells them or they think, hey, I
made it
older
this
now.
far.
Yeah.
Yeah.
It's,
Right.
the likelihood, but you never know.
And
So,
that's all kinds of screenings. It
Yes.
could be colonoscopy, or it can be your breast cancer screening,
Yeah.
or what other screenings? Those are like the two big ones that pop in my
Yeah.
head. I guess getting your skin check every
skin
year,
check
right?
is extremely important. That should definitely be done annually. Mammograms for breast cancer, colonoscopy, you hit the nail on the head there. Also, if you're feeling something and you're unsure, talk to your doctor, because maybe it's a lung screening. There's so many different things, and it can save a life. I know that sounds really cliche, but it's so true. The earlier that it's detected, or even prevented
Right.
altogether, can
Right.
make a world of difference. So not only yourself, but encourage your loved ones to get screened as well.
Definitely. Oh, that's a great message. Thank you so much for joining us today, Kayla.
Of
It's a lot of
course.
great information. We're going to put some of that information up on the screen, including the website that you can go to, as well as phone numbers. Thank you so much for joining us today for this episode of Create Conversation, and we will see you next time.